Hi, everyone. Welcome. We will be getting started in just a minute while we wait for allow time for people to log in. Good afternoon, everyone. Thank you for joining us as we discuss an extremely important topic that has impacted our communities over the last several months. My name is Adria Cordova, president of ALPFA Philadelphia, and I would like to welcome you to our healthcare panel on COVID-19 health equity considerations and learnings. ALPFA is the Association of Latino Professionals for America, and our mission is to connect and inspire the next generation of Latinx leaders for impact. While we have Latino in our name, we are not exclusive to the Latinx community. We are a diverse and inclusive organization and aim to host events that are relevant to everyone, especially minority communities. I'd like to thank our valued partner, Astrazeneca, as well as Independence Blue Cross and Temple Health University for collaborating with us on such an important topic. Your continued support is not only greatly appreciated, but it is vital to the success of our organization. To our attendees today, our partners are looking for diverse talent. If you're interested in opportunities at AstraZeneca or Independence Blue Cross, please send us your information and we will connect you with their teams. As we have all experienced, COVID-19 has turned our world upside down, causing tragic loss of life and disrupting our social and economic order. Our panel today will discuss the healthcare disparities that this pandemic has exposed in minority communities and how organizations such as AstraZeneca and Independence Blue Cross and Temple Health are addressing the gaps. But before I introduce our keynote speaker, I'd especially like to highlight our panelists. 3 successful and influential Latinas who are paving the way for future generations in the healthcare industry. It's leaders like these women who we as ALPFA look to as role models. So ladies, thank you so much for your leadership. Lastly, it is my pleasure to introduce our esteemed keynote speaker, Mina Makar, Senior Vice President of U.S. Respiratory and Immunology at AstraZeneca. With a career spanning over 30 years, Mina is a renowned leader in the pharmaceutical industry and serves as the executive sponsor of the Hispanic Business Resource Group at AstraZeneca. Mina, thank you so much for your time and thank you for sharing your knowledge with us. You can take it away from me.
All right, great. Adria, thank you so much for the kind words, and the 30 years reminds me of my age, but hopefully some wisdom along the way as well. So, you know, just on behalf of myself and my colleagues, I just want to say I'm really thrilled to be engaged in this meaningful and really timely dialogue and discussion with the ALPFA members for Philadelphia, and along with Independence Blue Cross, Temple Health. You know, there's so many challenges, whether it's COVID, some of the social upheaval that we've been going through, other uncertainties that are facing our patients today. And it's really important that we pause and take the time to discuss what we can do together to tackle some of the very real health equity challenges that our Hispanic and Latino communities face. And you know, oftentimes people think that these challenges are somehow new and have come in light because of COVID, but really these challenges have always been there. What's happened with the COVID pandemic is it's put a magnifying glass on, it's elevated, you know, the entire U.S., you know, population to what is the urgency here and raised awareness. And it's one of those unique moments where the opportunity is in front of us to really take some concrete action and to make some progress on an issue that has been present for many, many years. And that's why I'm excited about the panel discussion that'll come up in a little bit. And, you know, as I speak about Astrazeneca and my own experiences, I want to leave you at the end, hopefully in the next 10 minutes, with 3 messages from me to you. And the first is, there's a lot that we can do. We have to act with urgency. We have a unique opportunity right now to address health equities. We need to take the opportunity to do so. The second is, it really doesn't matter. I know we have people on this call that are still students. We have others that are young professionals, others that are fairly mature in their careers. It really doesn't matter where you are, what role you play. There is something that you can do to make things better. And the final thing I'll leave you with is, we can't do this alone. And rallying others around us and other stakeholders around us is how we solve complicated issues like this. And those are the 3 points that I'd like to leave you with when I'm done. When I look at, you know, I had a chance to look at ALPFA's Philly chapter mission statement. It talks about connecting and inspiring the next generation of Latino leaders for purposeful impact in the greater Philadelphia community. And I think that's fantastic. And it reminds me a bit of, you know, my own leadership purpose that I set for myself many years ago, which is really beyond any performance in the marketplace or business, you know, results. At the end of the day, what I believe my role is to leave a legacy of future leaders that are better than me, that are more successful than I've been, that at the end of the day make a real difference in the lives of patients and the physicians that they serve. And I think that's very similar to the mission statement of ALPFA. And many of you, like I mentioned, are young professionals. And let me start by congratulating you on being members of ALPFA, because to me, it means that you're looking for a way to contribute to your community and to society at large beyond your day-to-day work. You've already learned something that's very important, that we always have to find a way to serve, to contribute, to make things better, to never underestimate what we can cause and what we can inspire, no matter what role we're in, where we work, or where we are in our career. And those are lessons that I've learned over the years, and, you know, which is why I'm so honored to be serving as the executive sponsor for the Hispanic Employee and Business Resource Group at Astrazeneca. It's a group of over 400 active and committed employees. And you may have noticed from my name or something else that I'm not Hispanic. I'm actually from the Middle East. I'm Egyptian. I immigrated to the US as a child and, you know, grew up in a little town in the Midwest in Iowa. And I can tell you, there were very few people who looked like me, who thought like me, and certainly very few who ate similar to the things I grew up eating. But, you know, along that way, I learned so much around the value of diversity and the importance of surrounding yourself with people that look and think differently and have different backgrounds and different experiences. And I have learned so much over the past 2 years working with the Hispanic Employee Resource Group. It's shaped a lot of my thinking around the topic we're discussing today. And it's really helped me grow professionally. So I've been at AZ for 20 years, and I have to tell you, picking the right organization to be a part of is so critical. And as I look around the discussion we're having today around health equity, health disparities, the impact of COVID on those communities in general, you know, and I think about what we've done as an organization, and I'm so proud of what Astrazeneca has done globally, whether it's things like the Young Health Program that we launched several years ago with Johns Hopkins that is targeted at helping young people get past non-communicable diseases across multiple countries throughout the world, in Latin America and Africa in particular. It operates in 18 countries, and we recently just partnered with UNICEF on that with a $35 million grant to get to millions of young people as early as possible. Our Healthy Heart Africa that is intended to, help 10 million at least people in Africa with cardiovascular disease. And we've partnered with multiple stakeholders throughout that continent to build a sustainable platform of no profit, no loss business model that allows us to reach as many patients as possible. Or here in the US, Connections for CV Health, where we've been able to partner with local nonprofit organizations throughout different communities. A perfect example recently is in Charlotte, North Carolina, where we worked with Camino Community Center on a program they call Camino Vida, which is intended to help uninsured Latino populations in North Carolina. They've helped, I think, somewhere on the order of 20,000 patients in the last year alone. All of those, I hope you see, are all multiple stakeholders coming together, trying to find better ways to address the challenges that we have with access to healthcare and in vulnerable populations. The organization that I lead is Respiratory and Immunology here in the US, which is made up of severe asthma, COPD, asthma in general, and lupus, among other disease states. And if you think about health disparities in those respiratory and in lupus, it's profound in minority populations. And post-COVID, it's become even more of a challenge. If you think about COVID impacting respiratory disease and impacting respiratory symptoms and respiratory patients being at higher risk, and you think about severe asthmatics and COPD patients and the significant challenges that COVID has caused in those patients. And when you think about asthma, African-American and Hispanic Americans, much higher rates of asthma than the broader population. In fact, in the US, Hispanics of Puerto Rican descent, #1 rates of asthma of any ethnic group in the US. COPD, 4th leading cause of death in the US, underdiagnosed, undertreated, preventable. But we know as income goes down, rates increase and morbidity increases, and we need to be able to reach patients in the right populations better. Lupus, 2 to 3 times more prevalent among people of color, including African Americans, Hispanics, Asians, Native Americans. And in these groups, lupus often comes with a higher death rate, higher severity of disease, earlier onset. And so within my team, as we look at all of these challenges, it became a clear priority for us, as I'm sure for all of you as you think about the areas that you work in, to find real concrete ways to address these challenges. And they're complex, right? They're not simple. Whether it's addressing prevention, hospitalizations, access to care, clinical trial representation, among many other things, it was really important for us to think about what are the areas that we can directly impact. And what we found, and an area that I believe is critical for all of us wherever we work to focus on first and foremost, is our own employees and strengthening the foundation of our own people. Because at the end of the day, the solutions to trying to solve some of these issues will come from everybody within the organization. And so you have to have a diverse organization that understands the issues. And so we've invested heavily in recruitment, building our bench, recruiting diverse candidate pools, forging the right connections with external organizations, outlining mentorship and development pathways within our own employees here to make sure that everybody has a chance to have a mentor and an ability to grow professionally and have somebody who's looking out for them. Encouraging open dialogue and diverse voices within leadership teams and within teams overall to make sure that we have the right diversity of voice on a lot of these issues as we think about them. And then we begin to look externally, and the first place we focused on is patients. Because at the end of the day, we need to be a very patient-centered organization and group of people if we're going to solve these issues. Everything from making significant changes around how we do multicultural marketing and communications with our brands. How do we effectively communicate with diverse populations? How do we support nonprofit and professional organizations to address health disparities? You know, we recently partnered with a pulmonology professional society to provide in the Chicago area thousands of N95 respirators to predominantly Black and Hispanic neighborhoods that were under-resourced, right? Increasing our diverse population representation in the clinical trials and making sure that we engage everybody within the organization to effectively do that. And finally, partnering with physicians who at the end of the day are the front lines and working incredibly hard. And we all see in this COVID environment, just the stress level on physicians and other healthcare providers who care so much for patients and for trying to address a significant burden, but many times struggling for resources and for the right, ability to communicate with every patient. And so we focus on implementing diversity in our clinical education, medical practice, data transparency, clinical trial representation, training our representatives and everybody that engages with physicians on how to have a more culturally mindful dialogue, ensuring diverse representation when we look at who we bring in, whether external partners, speaker bureaus, other things. How do we make sure that it's diverse population so that we're getting and providing the input that matters? But at the end of the day, like I mentioned at the beginning, working across multiple stakeholders is the only way we can move with speed. I think about recently, we released working in partnership with organizations across government, patient advocacy, physician organizations to put together an asthma disparities in the US roadmap that was recently published. We would never have been able to do that as Astrazeneca alone. It needed nonprofit organizations, patient advocacy organizations, government, physician groups in order to put together a comprehensive roadmap like that, or a tool to identify ICU trained physicians and how to move them into COVID-19 overwhelmed hospitals, and working with a professional society to build that type of tool. The translation of many COVID materials that we've been able to do successfully, working with different organizations to make sure that whatever patient walked into that clinic or into that hospital, we had a way to engage with their caregivers and their family members. All of these are things that require multiple stakeholders around the table, solving with urgency and with speed. So I'll leave you with this. I'll end with where I started. First, congratulating you on wanting to be a part of the solution and being engaged with ALPFA. There's a lot to do. We have an opportunity now that has been brought about by COVID and the impact of it. As the magnifying glass has become bigger and everybody is talking and thinking about it, we need to take the opportunity to really make a difference. We have to act with urgency to address health equity. I will remind you that you can have an impact and you can cause change no matter where you are in your career, no matter where you work, no matter what responsibilities you have. You have amazing ideas. You want to help patients, you want to help people, you want to help communities. Don't ever be afraid to offer your ideas and to start change. And finally, we can't do it alone. We have to do it together, and that's the secret. So never lose your passion or energy, no matter what hurdles come along the way. As long as we're moving forward and improving outcome around health disparities for patients and communities and societies, whatever hurdles along the way, that's okay. We'll just keep moving, and eventually we'll solve this for everybody. So with that, thank you for the time. I'll turn it over to Carolina, who will take us into the panel discussion. Carolina, all yours.
Thank you. Thank you, Adria, and thank you, Mina, for such a great introduction and a great keynote address. For the last 4 years, I have been part of the ALPFA Familia here in Philadelphia, and I cannot be more excited and proud of being part of this collaboration with ALPFA, as you do a tremendous job supporting our community and supporting our Latino professionals. So thank you so much for that. As Mina and Andrea said, COVID-19 truly has come with lots of challenges and lots of learnings for all of us. And I cannot be more excited to have such an amazing panel of healthcare women professionals that are gonna help us through all this journey that we have gone through COVID-19. But before I introduce our fantastic panel, a couple of items for our audience. It's so exciting to see over 100 of you join us today, and we want to hear from you despite you have your lines on mute. But at the bottom in the Q&A chat function, you can put your comments or your questions, and we will be more than happy to address those questions and comments. So if you had any questions for Mina, for Adria, or for our panel session that we're about to start, please feel free to add them there, and we will have make sure that you have time to get your answers towards the end of the session. So with that, I want to introduce our panel. I'll start with Dr. Maria Elena Vega. She's the Interim Director of Pulmonary and Critical Care Fellowship at the Lewis Katz School of Medicine at Temple University. Then we have Lorena Plaza, Vice President of Financial Planning and Analysis for Independence Blue Cross Blue Shield, and Odalys Caprisecca, Executive Director for Market Access Pricing and Operations at Astrazeneca. So welcome, ladies, bienvenidas, and thank you for being here. So to get us started, I'm going to start with you, Dr. Vega. Back in April, at the peak of COVID-19, the Health Share Exchange report placed Temple University Hospital as the system treating the highest number of COVID-19 patients in the region. And you have been at the front lines treating those patients, especially the Hispanic and minority patients. Can you share with us a little bit of your experience, some of the challenges that you and your staff had to endure to respond to COVID-19 and support those patients?
Thank you, Carolina. And yes, so first of all, I just want to echo what Mina said about that COVID highlighted the health disparities in minority populations. But what I can tell you about my experience treating patients with COVID-19 at Temple is that I never felt like we were not prepared. We were lucky to have PPE, we were lucky to be really organized, and I think we provided excellent patient care to all our patients, including the Hispanic population. We are able to offer not only standard care of treatment to our patients, but we were also able to enroll them in clinical trials. So I think that is actually new, and I was really glad to see that we were able to enroll Hispanics, because in the past non-English speakers have been excluded from clinical trials, but we were able to offer novel therapies by including them in these clinical trials. And you probably know that these clinical trials are not available in most US centers currently. And I think that the biggest challenges that we faced when we treated Hispanic patients were related to communication and also cultural differences. Because as you know, in the Latino community, we tend to live with multiple generations in the same household. I can tell you that my mother-in-law is visiting right now, and also my brother-in-law. So we had entire families hospitalized at the same time. And a lot of young and old people died. And it can be terrifying for a patient if they can't understand their physician. Hispanics rely on family members sometimes to translate, and now they're isolated because of the pandemic. So I think those were the biggest challenges we faced.
Thank you for that. And as you said, our families tend to be large and tend to be together. So you sharing a little bit of the experience that you saw with the families and the members that that had been impacted by COVID-19, and how Temple was ready to address those needs of those patients and support them not only with their treatment, but also with clinical trials where Hispanic patients have access to be part of it. So thank you for that. In your experience, what has made minorities more susceptible to COVID-19, and what minorities can do to close the gap on such disparities?
So it is known that minorities have been disproportionately affected by COVID-19, and there are a few reasons for that. So first of all, minorities are essential workers, so they can't afford to stay at home. They are exposed to the virus, they are more exposed to, they're more likely to be infected, and then they bring the virus home, like I said, and they infect grandma. The second thing is cultural differences. It makes it really hard for Hispanics to practice social distancing. It's challenging. Another issue is reduced access to healthcare. Hispanics are less likely to have health insurance. They're less likely to have a primary care physician who can provide some guidance when it comes to diseases. Severity of illness, I think it's a reflection of that poor access to care, because a lot of our Hispanics waited home for many, many days when they should have probably gone to the hospital to seek attention. They were terrified of coming to the hospital, and have they had a primary care physician or someone to help them, they would have come earlier and could have done something more for them. I think misinformation and lack of information is another problem in minorities. And to answer your second question, what can minorities do to close the gap? First of all, I think apply for health insurance, start a relationship with a primary care physician is paramount to prevent diseases, to keep you healthy. I think that health literacy is paramount and is really powerful.
Those are great tips in terms of educate yourselves, be proactive, looking for help with your primary care physician or other healthcare providers, and also ensure that you are active with your healthcare community. So thank you so much for that. As you join this session with healthcare experts that support patients with healthcare insurance options and medications, what are some of the things you believe we can jointly do better to serve our community and close inequalities?
So like I said, education is key. So I think that's where the federal and local government can help to inform patients about the available resources. We need more social workers. We need to create educational programs with bilingual and bicultural focus. We also need to educate providers about what is available for minorities, because we don't know sometimes, so we do need help in that sense. Access to clinical trials is paramount, and like I said, that was a positive thing that I was able to witness during our response to the COVID pandemic. And be aware that some communities and some minorities are afraid to come to the hospital. So I think it's important to engage the community, to identify leaders in the communities that can serve as liaisons so that we can help address those inequities.
That's wonderful. So collaborations on community programs, education programs that are tailored to bilingual, bicultural backgrounds, and continue to ensure there's access to healthcare across patient segments. I cannot thank you enough on behalf of everybody, I'm sure, Dr. Vega, for the work that you have done in the hospital, for continue to fight for patients and sometimes put your priorities aside to be there caring for patients and for our community. So I so appreciate that. And now I'm going to turn a little bit to another aspect of healthcare, which comes from our insurance payers. And Lorena, thank you so much for joining us today. and for being here. At Independence Blue Cross Blue Shield is the leading health insurance company in Southeast Pennsylvania, and its family members serves about 8 million people nationwide. So I'm sure you had to readjust your priorities for 2020 when COVID came to support the members and the customers due to COVID. So can you share with us a little bit about your experience, especially as the Vice President of Financial Planning, on these difficult times with Independence to serve your members?
Thank you. Thank you first, Carolina, ALPFA and Astrazeneca. I think that, for putting this together, this panel to discuss such an important topic. I think, we talk about how COVID had highlighted the health disparities. Those were there. They're just now highlighted by what is happening. And, and also to share a little bit what are the things that we have been doing at Independence. So Carolina, you mentioned that certainly this required to change our priorities. So it certainly did. Early in the year, we have to shift our priorities. We put together a group of people that our focus was to continue to do what we do at best, which is serve really our members and our stakeholders. So what it really means for us was to put together a really a set of ideas and strategies that we can assist these members, our customers, providers, as well as our communities. And just to share some of the things that we have been doing, that I'm really proud of how we have reached out to each one of these groups, and especially the community. That's one of the things that personally have really attracted me to Independence when I joined 2 years ago. So I would say on the member, some of the things on the member side that we have done were to, waive costs for COVID-19 testing and care, which was so important in these unprecedented times, expanding coverage for telemedicine to make sure that people stay safe, but also taking care of their needs. Modified prescription refill rules so they can get access to that without, again, having to stay at home and safe. On the customer side, our customers were also looking at us to help them with their employees. So we offer medical and dental premium credits, premium rebates. We have been accepting credit card payments and offering deferred payment plan options as a way to alleviate the financial burdens, right? So COVID also put that pressure in the society. In terms of providers, the providers were and are in the front lines of this crisis, so we also wanted to help there. So we wanted to make things also easier for them by suspending COVID-related prior authorization through 2020, enhance access to testing kits, launch a COVID-19 a provider hub, so there is an online tool so they can have an easy access to latest information. Communities is something that is at the core also of what we do at Independence, and the communities that we serve, they really rely on our commitment to really improve health and the well-being for everyone. So we supported that through a few series of grants. For example, the PHL COVID-19 fund that supported nonprofits. Also through our foundation, grants to community health providers. We work on several public awareness campaigns like Beat COVID-19 or Mind PHL Together, which was a mental health awareness campaign with the city. And that's such an important topic that has become also very relevant with COVID-19. And I would say that last but not least, all this would have not been possible without our employees. So as one of the region's largest employers, we mandated working from home very early in the process while continue performing at the highest level and making sure that our employees have the tools to do that. We have been trying to reach out to them via videos that some of us are doing on a weekly basis, including our CEO, Dan, as a way to connect with our employees working from home while they have all adapted to that. It's still that distance, and we're trying to connect with all of them. So to sum it up, Carolina, it's yes, we had to readjust to our priorities for 2020 with our goal to continue to support our stakeholders through these unprecedented times, but also to continue to do so. The pandemic is not over, and we are on all of this together. So we have to continue doing that.
That's fantastic, Lorena. Thank you. And it's amazing how when you have to readjust, how agile you can be. And you just share a little bit of all the different tentacles that IBC touches from the your members, and you had to readjust prescription refills and telehealth options and medicines to your employees, and how you make sure your employees are healthy, are safe, are engaged. And also providers, ensuring that your providers were their process of prior authorizations and all that was running smoothly, as well as your commitment to the community and the nonprofits. So there's so many aspects of healthcare that as an insurance company you touch, and you had to readjust pretty quickly to support everyone. Also, as you know, in 2020, the issue of healthcare disparities has become more prevalent than ever before. And we seek opportunities to address those challenges. But I'm sure that internally you have been looking as to inclusion and diversity and the disparities that exist. So can you share a little bit about Independence Blue Cross viewpoint on inclusion and diversity and addressing healthcare disparities, especially around minorities?
Sure. So I think that I would start by saying that this year's events show that America hasn't yet made good on its promises of equality, and that includes healthcare. We at Independence are committed to help to bridge that gap, and that it starts by recognizing that there are many factors that contribute to health, and we must address the social determinants of health, as well as the physical determinants. We touched before, right, that it's clear that COVID-19, the care and outcomes were not the same across the communities. So we have tried to support that effort by addressing some of these. For example, supporting the Black Doctors COVID-19 Consortium, which works to address community needs for food insecurity and access to COVID-19 testing. We joined the Pennsylvania Department of Health, Latino Connection, and Highmark Blue Shield to announce the state's first mobile response unit to provide COVID-19 testing and education, again, addressing certain population. You mentioned health disparities, and again, those existed before, right? So this has just exacerbated that, and we have a duty there. We have to address the social conditions in our neighborhoods that help create that. So some of the things that we have been doing, for example, is together with Signify Health, we launched Community Link. It's a network of community-based organizations that connect people to non-medical services, food, housing, transportation, right? That helps improve health. We partner with PHMC, Penn Medicine, and Trinity Health to transform Mercy Philadelphia campus, so to provide community-informed care and services to serve the needs of the West Philadelphia neighborhoods. And we are working together with Project Home and launch the Keystone Connection to Wellness initiative. So that's also to increase the services available in specific areas in North Philadelphia, in those neighborhoods. We have also reached, we really make an special outreach to connect with the Latino community. And that is, our focus as well. We have to also redirect a little bit how we were doing that in 2020, as we usually do that by having, a mobile unit, bilingual representatives at events, churches, and stores. Not possible this year, but we have redirected that by doing, other things like participating on a Latino-focused virtual events, engaging in social media, and how to reach out to those groups. You touch, on diversity and what we do as a company. Diversity is one of the strengths of our company. It is actually one of the cores, and it's part of our own strategy. It's one of the pillars of our own strategy. So both really on the workforce and our business relationships. We have several associates groups We have some of them taking key roles in Independent's broad response to racial justice concerns through our panels, discussions, and development of ideas. We are proud to stand with the Blue Cross Blue Shield Association and all 35 other Blues in a pledge to fight racism across the country. We have a supplier diversity initiative, right? Where we try to reach out to making sure that we have suppliers that are from a diverse background. I'm actually the co-sponsor, the executive co-sponsor of the Latino group, together with another executive in the finance team, Juan Lopez, who actually got me into the group a month after I joined the company. And so, you know, what I would say, just to summarize on this point, is that it is important to us that Independents to rely on our corporate culture of diversity and inclusion to guide our efforts to advance inequality. A way we do this is by focusing on social determinants of health, as socioeconomic factors like housing, education, food access play a major role in a person's health, which has been more than evident during COVID-19.
That's fantastic. And thank you, Lorena, for sharing a little bit about your commitment internally as an inclusion and diversity organization and what you have done with the Latino Business Resource Group. And then you continue to do in the community to address social determinants of health, supporting and partnering with the Blue Cross Blue Shield Association, the Black Physicians Consortium, and so many things. I hope this audience, as you're hearing Dr. Vega and Lorena, you're getting excited on all the efforts that members are putting to support our communities here in Philadelphia. And I know ALPFA has a broader membership across the nation. So just wanted to remind you, if you have any questions or comments, please feel free to put them on the Q&A chat function, and we will be able to address them later. So now I'm going to move on to Odalys, and I have been able to experience firsthand the commitment of your team and yourself during this pandemic and supporting all the patients. So, as you know, Odalys, the financial difficulties of COVID-19 pandemic in our society are real. And with your expertise in pricing strategy and affordability, can you share some of the considerations taken at Astrazeneca in 2020 around affordability and access to medicines for patients?
Great, thank you so much, Carolina. Thank you so much to ALPFA for this opportunity, and to my fellow panel members. What an honor to be here with all of you today. So that's a great question. We at AstraZeneca, not only during obviously the COVID pandemic, but at all times make very much into consideration the pricing of our medicines. At the end of the day, if our patients don't have access to our medicines, they're not really much good on the shelf. So it is huge for us to do it. So basically AstraZeneca, obviously, as we all know, is a science-led based biopharmaceutical company. We have innovative medicines around the world with millions of patients. We really focus on that patients, and the science is really at the core of everything that we do. So there's lots of careful considerations and determining the value, and that's a very key word. Value is kind of a lot of different meanings. Whose value? Is it, you know, Dr. Vega's value of how they're going to treat that patient? Is it the patient's value? Is it from an overall healthcare provider? So we really need to look at it from a very multifaceted perspective of what really is value. And at the end of the day, that cost, and at the end of the day, making sure that the patient that really needs it is going to have access to their medicine. And we are reducing all barriers that are important to that. We've been talking a lot about the benefit. So it's important to figure out, what does that benefit look like? Obviously, there's a clinical benefit that has to be taken into account, but is it a benefit in that perhaps this treatment can be done by the patient in their home? Is it a benefit that they don't have to go to different sites? Is it a benefit that perhaps the treatment is weekly versus daily? So what are all of these types of benefits that perhaps we can bring to the patient, to the community, to the overall healthcare? There's also the overall spending. Is it something that the patient can do at home so we don't have this additional cost from a hospitalization perspective? Is it once weekly versus every day? Those are the different kind of things that it's very important to take into the consideration. And one other thing to think about that's important for us is today's medications are helping us in the future, not only from a learning perspective, a clinical perspective, a comorbidity perspective, but allowing us that opportunity to then invest for discovering for tomorrow, what is going to be needed for tomorrow. Sudden things come around the corner like this pandemic. So how are we prepared in our learnings to help develop for that future? One of the other areas in considering pricing that we've been talking about today is we're not doing it alone. It really is the community. So one of the things from an Astrazeneca perspective is ensuring that we're involving all stakeholders. So reaching out to providers, help me understand your treatment of this, help me understand your patients, help me understand what are they facing today, what is it that we need to do, what will this really bring to your patient, to your treatment. When we speak with our payers, right? So what do you envision this in your total cost of care? What do you think about site of care? Where is the treatment happening? Our advocacy groups, very much what we've been talking about. How are we getting this information out to the community? How will we inform our patients to have them learn about this? Is going to be extremely important about that. Again, at the end of the day, it's not so much the pricing of the drug, it's to ensure that we're doing it to provide the benefit being clinical, benefit being financial, benefit being overall quality of care for that patient. So ensuring that we have all of that with our partners, with all of this feedback, and really ensuring the understanding of the patient population. Who is this patient? Is it an elderly patient? Or is it a young patient? Is this treatment at home? Is this treatment in the hospital? Is it self-injected? Is it require the doctor? So all of these things have to be taken into account. It's not simply writing a prescription and, you know, here you go take it. Or it's not specifically, I'm going to go see my doctor tomorrow and it's all taken care of. We really need to understand that journey. That really is important to us, because at the end of the day, we need to make sure that the patient has access to it, but just as important, it's key to us to ensure that it's that right patient getting that right medication at the right time and at the right location.
Thank you, Odalys. And that was a great overview of value, right? And all the value that medicines bring from a clinical standpoint to a delivery standpoint, and understanding that patient population as to we're talking. And I know here at AstraZeneca, we have put a lot of work into affordability programs and looking at the diversity within our patient population from all the different disease states that we're talking and the different medicines. But a common denominator I keep on hearing among the three of you is that area of collaboration and coming together to serve patients and support them during COVID. This year, despite the pandemic, here at AstraZeneca, we needed to make sure that all patients, even with pre-existing conditions, were served. Those ones that were dealing with oncology, respiratory, cardiometabolic diseases. So can you share a little bit about the efforts done to support those other patients despite the challenges?
Yeah, so that was very important to us. It was an immediate reaction of saying, okay, there's a change. How are patients going to be able to access their medicine, right? What do we need to take into account that might be different based on this condition? So the wonderful thing was we had a lot of programs in place that we always have from that. So we were able to, with agility, respond and make some quick tweaks. So throughout the pandemic, right, we stayed very much committed to ensuring the patients had access to our medications, albeit in very different mechanisms or in different methodologies of obtaining. So one specific one that we wanted to speak about for the community was our program called AZ and Me. It's one of the largest outstanding patient assistance programs that has helped over 4.5 million patients since its inception. So it's been around for a long time. We have lots of learnings and lots of ways of mechanisms of doing it. So the key to the program, it's designed to assist patients that can't afford their medications. So specifically during the pandemic, we took additional steps for these patients that were already enrolled in our program. So they kind of said, okay, yesterday I got my medication in this way, but now the world has changed for me. What is it that I need to do? So what we were doing is we were able to quickly respond by addressing those patients that were already in the program, and perhaps we had sent out additional dosing of medication. So perhaps a 30-day was a 60-day or a 90-day, so they didn't have this concern of not having access to their medications, or a concern of having to go somewhere to get it, or their family members to get it. So we were able to increase the amount that we were able to ship for them in the refills. We ensured that their refills were available early to them, right? To a big piece of it also, and as we've been talking about, was it was more of a peace of mind, right? To ensure to our patients, you're going to continue to have access. You're not going to be affected. It's going to be okay. So we were able to increase not only the length of the script, but the frequency in which we were able to send that out to them. Additionally, right, some patients found themselves with a job loss, or perhaps an insurance loss, or change of program, or something like that. The good thing was, obviously, this program is designed specifically to handle those types of change in circumstances that we call. So from an eligibility criteria, those patients had a quick access into these things of AZ and Me. Along with that program, of course, Astrazeneca has huge partners like an AmeriCares, in which we continue to donate product through charitable clinics and institutions, again, ensuring that our products are available through very many different channels and however it's needed. And then, of course, Astrazeneca also has our copay assistance program for eligible patients that is also necessary. And above that, from the access perspective, one of the other things that we activated very quickly was our policy team, our DC policy team. So ensuring as things were changing, that we were ensuring we were keeping up with it to ensure that we were meeting the demands and changing with it. You know, we saw a huge change overnight in telemedicine, right? So how are we up to date with all of our policies to ensure that the site of care, how those medications were being administered, who needed them at what place, to ensure coverage wasn't interrupted, to ensure the affordability from the patient. So there was quite a bit of work as well that AstraZeneca, from a policy perspective, both at the federal level, even at the state level, how did we ensure that things were needed wherever they were needed to, was a huge piece of what we did as well.
Thank you, Odalys. And, you know, it shows how, whether it was the uncertainty of patients losing their insurance and being in that transition period, and how we can make sure that at least they didn't have to worry about their medicines, and that we were here to cover those, to policies that we don't even think that have to be readjusted when you are treating patients virtually versus seeing them on the clinic, and to refills. You know, we are all, as a Latino community, very used to walking into our pharmacists and seeing our pharmacists, and now everything has to be done through mail order. So it's great that the agility of that, and I hope our audience is hearing how we had enough uncertainty in 2020, but when you look from a physician standpoint and a hospital system to an insurance to us as a pharmaceutical, we have readjusted to ensure, to the best to our abilities, be there for patients. So thank you, Odalys, for that. Now, ladies, having an event like this one, where we have Latino professionals and where we have female leaders in this session that go from Mexico to Cuba to Colombia, Ecuador, and Argentina. And we have to acknowledge the fact that Latino women are being underrepresented in the healthcare sector. And in 2020, it has been the Latino women hit the hardest in terms of unemployment compared to non-Hispanic women. So knowing that we have a Latino professional audience today, I would like to ask you, as a successful Hispanic American woman contributing to our healthcare industry, can you share some of the remarks of your journey as a Latina and some advice that you can provide to minority women that are aspiring to be successful in the healthcare sector like you have been. So I will start with Dr. Vega.
Thank you, Carolina. So what I would say is that there's really no limit to what you can do. I think that the only thing keeping you from reaching your potential is probably lack of self-belief. So I like to believe that we live in merit-based society, but you will face challenges, but that should not deter you from achieving your goals. And I think that this is the best time in history to be a woman. So what I would say is to take advantage of that, take advantage of the path that has been created by other women, and continue to build a path for those women who are coming behind you.
Thank you. That is definitely a great advice. How about you, Lorena?
Thank you for that question. I think that I would like to make my point towards a call to action, and that is to those Latina women who have been able to get to a leadership role. And that action is to help others to get there as well. One thing that is clear for us when we look up is that lack of representation. The Hispanic population in US is about 18%, but we don't see that same representation in leadership roles. My journey itself was not easy, not only as a Latina woman, I'm also a foreigner who started her professional career back in Argentina. But so what I want to do is I want to make it easier for others, and I want others to know my story so that they can feel represented. They can, and you know, they can know that they can also make it. So I have to ask, and that would be one is to those that are in the challenging path to get there, is to look for opportunities to get involved, to look for that exposure, seek mentorship, broaden your network. And then to those Latina women in leadership roles is to tell your story, give others exposure, help that network, be a mentor. We must do this. It is really our duty to help others to get there.
That's awesome. Thank you. So no limits, get involved, support each other. And now Odalys.
Yeah, so that's a great question. When you look back through the journey, I think amongst what has been said already, I think the other thing is every day, look to make a difference. And that can take on many shapes, sizes. It's sometimes small differences, sometimes it's big differences. But if you continue to do that and you live in that mindset, as Dr. Vega has said, like there is no obstacle. Sometimes we get in our own way, right? So if you really are saying, I'm going to make a difference, small, big, whatever it is, it's important for us to have that positivity and have that mindset every day, because that will help overcome the challenges. Because as Lorena said, there are challenges, absolutely. And I think one of the other things that has kind of helped me through the journey and helped me get to where I am and the challenges is, and I think Mina had mentioned this in the beginning, it's very important that we celebrate our differences, right? And bring that to light and see others, let others see us doing that, because that will bring everyone along. There are differences. We shouldn't hide behind the differences, but we should celebrate those differences. So I think it's very much as if you're making those differences every day, little by little, and you're then celebrating all of those differences, it helps open that door. It creates this environment, right? We talked about the Hispanic culture. We love the environment. We love our hugs. And so it's important to have that sense and see and allow other people to see that from you, that it's authentic and that it's okay, to help bring that along.
Awesome, awesome aspects of celebrate your differences. We are all different and unique, so we should celebrate those and make a point of making a difference. So what a fantastic panel and content, ladies. And now I'm gonna pass it to Sandra and our ALPFA members to close us out. Thank you, everybody.
Well, thank you. I think this was a great session. Thank you, everybody, for participating. To our panelists and our moderator, Thank you for sharing your personal and professional experiences and the lessons learned about how COVID-19 has affected minorities. I'm sure everybody by now has learned and gained some experience and perspectives on how we can see these role models, these Latino women, and an adopted Latino in Mina, and their personal contributions and professional contributions to their communities, because we are all in this. Don't forget that we need to be working across multiple stakeholders, because this is the only way we will make a difference. And don't be afraid of offering help, and show your passion. And do not allow obstacles to stop you. Take advantage of being a Latino and being a woman. We can make the difference and celebrate it, because in our diversity is where we can thrive. And before we close, on behalf of ALPFA, the Philadelphia chapter, I would like to say thank you to our sponsor, AstraZeneca, our contributors, Independence Blue Cross and Temple University, and to the moderator and panelists, again, gracias, and to the organizing team. You did an awesome job. And if any of you in the audience is interested in exploring job opportunities with AstraZeneca, please visit their website and be on the lookout for ALPFA's monthly newsletter. We will be sharing with you their postings. And to all of you, thank you for being here with us, sharing with us your 90 minutes today. Have an awesome week and a fantastic rest of your day. Bye-bye.